It seems like AI is popping up everywhere these days.
It really is amazing.
But this one someone sent us really piqued my interest.
Oh, what's that?
Using AI to make diagnoses from MRI scans?
Yeah.
Like, seriously,
Yeah.
wow.
Yeah, it's a pretty remarkable stuff.
So this case was about a 72-year-old patient,
Right, 72 years old.
and they had swelling in their left leg.
Okay.
And they'd had this swelling for 15 years.
Wow, that's a long time.
I know, right?
So what happened?
Well, they started by feeding the AI the clinical notes
Okay.
and the ultrasound results.
Oh, gotcha. So the AI had some background.
Exactly. And
Yeah.
then they gave it the MRI images.
Okay.
But here's the thing, they gave the images like one at a time.
Oh, so sequence by sequence.
Yeah.
Sequence.
It was
Ah,
wild because
yeah.
the AI would give like an initial assessment after each sequence.
So it was building towards a diagnosis.
Exactly.
Wow, that's fascinating.
And get this.
What?
At one point, the AI thought it saw something,
Okay.
but then it like corrected itself.
No.
I know, right? It was so cool.
So like changed its mind.
Yeah, basically.
I got to hear more about this.
Okay, so first up was the T1 weighted image.
Right, the T1.
What does that one usually show?
Well, T1s are great for showing anatomy like the basic structures.
Okay.
In this case, the AI said the area of interest was hyperintense.
Hyper intense. What's that mean?
Basically, it means it showed up brighter than the surrounding tissue.
Like a bright spot.
Yeah, exactly.
Okay, so what did the AI think about that?
Well, that brightness can often indicate fat.
Oh, interesting.
So right away, it started thinking about things like lipoma or liposarcoma.
Which are both related to fat,
Exactly.
but it didn't stop there, right?
Nope. Then came the T2 weighted image.
Okay, what's different about that one?
Well, the T2 helps us see the makeup of the tissue a little better.
Oh.
And this time, the area was bright again.
Hmm.
But it wasn't like uniformly bright, meaning there was probably a mix of things going on in that area.
So more complex than just fat. And then there was the stir sequence.
The stirs, huh?
What's that one for?
Well, think of the stir as a filter to see fluid.
Oh, okay.
It basically mutes the signal from fat.
Gotcha. So it's specifically looking for fluid.
Yeah, and in this case, the area lit up bright on the S-star.
Meaning lots of fluid.
Exactly.
Okay, so we're starting to get a picture here.
We are.
But then things got really interesting with the post-contrast images, right?
Oh, yeah. Post-contrast, those are key.
What do they show?
So post-contrast images tell us about blood flow,
Okay.
like how the blood vessels are acting in the area.
Huh.
In this case, the area did show more contrast uptake,
Meaning?
meaning there was increased blood flow.
Okay, but there was a catch, right?
You got it.
It wasn't all even.
Nope, it was patchy.
So what did that tell the AI?
Well, it suggested that there were solid parts mixed in with the fluid-filled areas.
Getting even more complex.
Right. So at this point, the AI had seen 4 images.
Yeah, T1, T2, SDIR, and post-contrast.
And based on that, it narrowed things down to either a myxoid liposarcoma or a lipoma with myxoid changes.
Okay, and those are...
Both types of tumors that have fat and fluid.
Which fits what we've seen so far.
Right. But then came the diffusion-weighted imaging.
Or DWI.
Yeah. And the ADC map.
And that's when things took a turn.
A surprising turn.
Yeah, the AI seemed to hit a snag.
It did. At first, it saw this bright signal on the DWI.
Okay.
And it thought, this could be restricted diffusion.
And restricted diffusion means...
Well, it's often a sign of a more aggressive tumor.
Oh, so the stakes got higher?
Yeah, for a minute.
But then
it took a closer look at the ADC map.
Which tells us...
How easily water molecules can move within the tissue.
Okay.
And it realized that the high signal on the ADC map meant there was increased diffusion.
Not restricted. No.
Not restricted.
So like it thought it saw a traffic jam.
But it was just a busy street.
Exactly.
Wow, so it got it wrong.
Well, it misinterpreted things at first.
But then it caught the mistake.
Yeah, and it explained why. It said the initial brightness on the DWI was probably from something called T2 shine through.
T2 shine through, I've heard of that.
Have you?
Yeah, it's like when a really bright light shines through a thin curtain.
Okay.
You see the light but not the curtain?
So in this case, the bright signal from the fluid on the T2 was so strong it shined through onto the DWI?
And made it look like restricted diffusion.
Exactly.
Clever.
I know, right? The AI figured out its own mistake.
That's pretty impressive.
So after that little detour, what was the final verdict?
Well, the AI still thought it was most likely either a myxoid liposarcoma or a lipoma with myxoid degeneration.
Okay, so it ruled out some of the scarier stuff.
Right. But it also emphasized that a biopsy would be needed for a definitive diagnosis.
Which makes sense. You can't diagnose from images alone.
Definitely not.
But still, the way the AI got there step by step was fascinating.
It really was.
What else stood out to you about its analysis?
Well, I was impressed by how it paid attention to what we call negative findings.
Negative findings meaning?
Meaning things that weren't there.
Oh.
It specifically said there was no bone involvement and no significant swelling or edema in the surrounding tissue.
And
no signs of the lesion spreading.
why are those negative findings so important?
Well, think about it like solving a puzzle.
Okay.
Knowing what pieces don't fit is just as important as finding the ones that do.
I see.
These negative findings helped rule out other possible diagnoses,
Yeah,
and they supported the idea that this was likely a benign or low-grade malignancy.
that makes a lot of sense.
It's like Sherlock Holmes eliminating suspects based on what they didn't do.
Exactly. So we've seen the AI in action now.
We have.
But let's zoom out for a minute and think big picture.
Okay.
What are the potential benefits of having AI help with diagnoses?
Well, one of the most promising aspects is reducing diagnostic errors.
Even the best doctors make mistakes sometimes, right?
Oh, absolutely. Especially with complex cases or when they're tired.
Yeah.
AI could act like a second set of eyes, you know?
Catches things we might miss.
Exactly.
Like having a tireless assistant who never gets distracted.
That's a great way to put it.
What other advantages do you see?
Well, speed is another big one.
How so?
Imagine if AI could pre-screen images and flag potential issues for the radiologist.
Oh, so we could focus on the areas that need the most attention.
Exactly. They could save a ton of time.
And time is often crucial in medicine.
Absolutely, especially in emergencies.
But of course, with any new technology, there are concerns.
Oh, for sure.
What are some things we should be thinking about as AI gets more involved in healthcare?
Well, one big one is how these systems are trained. If the data used to train an AI is biased or incomplete, then it could lead to inaccurate or unfair results.
That's a good point. We don't want AI to make existing inequalities worse.
Right. So ensuring that AI systems are trained on diverse and representative data is really important.
That makes sense. What other concerns come to mind?
Well, the black box problem is another one.
Black box meaning?
Meaning that with some AI systems, it's hard to tell how they reach their conclusion.
So we don't know exactly what's going on inside, and that can make it hard to trust the AI.
Exactly, especially if we can't identify potential biases.
So we need AI systems that are transparent and explainable.
Yes, transparency is key.
What about the role of doctors in all of this?
Right.
Are they going to become obsolete?
Oh, absolutely not.
Okay, good.
I see AI as a powerful tool.
Okay.
But it's a tool to augment human expertise, not replace it.
So it's more about collaboration?
Exactly. Doctors bring so much to the table. You know, they're training their judgment, their ability to connect with patients.
Those are things AI can't do.
Not yet, anyway.
So it's the human doctor who makes the final decisions?
Yes, using the insights from the AI along with the patient's individual needs and circumstances.
That's reassuring to hear.
Good. I'm glad.
Now, I'm curious, would you feel comfortable having your own scans analyzed this way?
Honestly, I think I would. Yeah, the potential for faster, more accurate diagnoses is pretty compelling.
I can see that.
But I definitely want to talk to my doctor about the AI's findings.
Make sure you understand what it all means.
Exactly. It's about being informed and involved in the process.
That's a great point. It's about empowering patients.
Exactly.
So we've seen how AI can analyze a single case.
We have.
But let's zoom out even further now.
Okay.
If this technology becomes widely available, how might it change the entire landscape of healthcare?
Ooh, that's a big question.
It is, but it's an important one.
It is, and it leads to all sorts of fascinating possibilities.
Well, then let's dive into those possibilities.
Sounds good to me.
We've got to take a quick break, but we'll be back in a moment to continue our deep dive into the world of AI in healthcare.
Can't wait.
Yeah,
it really is amazing to think about how AI can change things.
So we were talking about AI reducing errors. Are there specific types of errors that AI is particularly good at catching?
Oh, absolutely. Think about those tiny details that are easily missed.
Especially when a radiologist is looking at so many images every day.
Exactly. It can be overwhelming.
And AI never gets tired.
Right. AI is great at pattern recognition.
So it can pick up on those subtle things that we might miss.
Yeah, especially when fatigue sets in.
Are there any examples where AI has already shown promise in this area?
There's been some really encouraging research using AI to analyze mammograms.
For breast cancer?
Yeah, for early signs of breast cancer.
Good.
And the AI algorithms have been able to detect subtle patterns.
That are linked to cancer.
Exactly. Sometimes even outperforming human radiologists.
Wow, that's incredible, but also a little unnerving.
I know, it's amazing what AI can do.
But it also makes you wonder about the challenges of training AI to be that good.
Oh, it's definitely not easy.
What are some of the hurdles?
Well, one of the biggest ones is making sure the AI is trained on a huge and diverse data set.
Of images.
Yes, if the data set is too small or not varied enough.
The AI might not be able to apply what it's learned to real-world cases.
That's exactly right.
It's like if you only show a child pictures of robins, they might not recognize a blue jay.
Perfect analogy.
And it's not just about the number of images, right?
Nope, the quality of the data is super important too.
Yeah.
The images need to be labeled correctly, and there needs to be a way to catch and fix errors in the data.
It's a massive undertaking.
It really is. It involves a lot of collaboration between different experts,
Data scientists, medical professionals, software developers.
all working together.
You mentioned earlier that AI could also help speed up diagnoses.
Yes, definitely.
How would that work in a practical sense?
Well, one way is through computer-aided detection systems.
Or CAD systems.
Right, some hospitals are already using them.
To help radiologists be more efficient.
Yeah, the CAD system does an initial scan and highlights areas that might be suspicious.
Oh, so the radiologist can focus on those areas first.
Exactly. It's like having a research assistant pre-read a bunch of articles and flag the most relevant ones.
Saving you a ton of time.
Exactly. And that can be crucial in emergency situations.
Like if someone has a brain bleed.
Yes. If an AI system could quickly detect that on a CT scan,
It could make a huge difference.
potentially saving lives.
But of course, accuracy is paramount in those situations.
Absolutely. We need to be sure these systems are making the right calls.
So how do we ensure that
Rigorous testing is key.
in real-world situations?
Yes, comparing their performance to human experts.
So it's a constant process of improvement.
Exactly. We're always refining and evaluating these systems.
You also talked about AI improving healthcare outcomes.
Right.
How do you see that happening?
Well, for one thing, earlier and more accurate diagnoses can lead to better treatment. But AI can also help personalize treatment plans.
Personalized medicine, that sounds fascinating.
It is, imagine an AI system that looks at a patient's genetic information, medical history, and lifestyle factors, and then recommends the best treatment options for that specific patient.
Wow, so it's not one size fits all anymore?
Exactly. It's about tailoring treatment to the individual.
And that could potentially reduce side effects too.
That's the hope. Are there any other ways AI could contribute to improve care?
Well, I was thinking about remote patient monitoring
Oh, yes. That's a great example. AI could keep tabs on patients remotely.
and alert doctors if there are any problems.
Exactly. It's like having a virtual guardian angel watching over you.
And that could help prevent hospital readmissions.
Right, which could lead to better quality of life for patients.
And I imagine it could help the healthcare system as a whole.
Absolutely, by identifying high-risk patients early on,
And enabling early intervention.
we could potentially reduce healthcare costs in the long run.
So we've seen how AI could impact diagnosis, treatment, and even healthcare management.
It's really quite remarkable.
But of course, we have to talk about the ethical implications.
Of course, any powerful technology comes with ethical considerations.
What are some of the key concerns we should be thinking about?
Well, privacy is a big one, because these AI systems are going to be handling huge amounts of sensitive data.
So we need to make sure it's protected.
Absolutely robust security measures and responsible data governance are essential,
It's about finding that balance between using data for good.
and respecting individual privacy.
What other concerns do you see?
Well, the issue of control and responsibility is a big one, too.
Meaning?
If an AI system makes a mistake, who's ultimately accountable?
Oh, that's a tough one.
Is it the developer, the hospital, the doctor using the system?
These are questions that don't have easy answers.
No, they don't. They have legal and ethical implications.
So we need clear guidelines and regulations.
Absolutely. As AI becomes more advanced,
You need to make sure it's being used responsibly.
ethical frameworks are crucial.
So it's not just about the technology itself.
It's also about how we use it.
We've talked a lot about AI's impact on healthcare systems.
Yes.
But what about its impact on the doctor-patient relationship?
That's an interesting question.
Do you think AI could fundamentally change that dynamic?
I think it has the potential to.
In what way?
Well, traditionally, doctors have held most of the knowledge.
They make the diagnoses and recommend treatments.
Right. But AI could give patients more access to information.
So they could be more involved in their own healthcare decisions.
Exactly. It's about empowering patients.
But could that also create challenges?
It could. What if patients start questioning their doctor's recommendations based on what they've read online?
That's a valid concern.
It is, and it means doctors will need to adapt their communication style.
Becoming more like educators.
Yes, guiding patients through the information and helping them make informed decisions.
So it's not about replacing the doctor's expertise.
No, it's about enhancing the dialogue.
Working together as partners.
Exactly.
We've talked about AI analyzing images and data, but what about the human side of medicine?
Like empathy and compassion?
Yes. Can AI ever truly replicate that?
That's a tough one. AI can be trained to recognize emotions, but I don't think it can truly understand or share a patient's feelings the way a human can.
So the human touch is still essential.
Absolutely, for providing comfort and a truly personalized experience.
As we explore the possibilities of AI in healthcare, we need to remember that technology should enhance the human connection, not replace it.
Couldn't agree more.
So if this technology becomes as widespread as some predict,
what kind of broader societal implications might we see?
That's a big question.
It is, and it deserves careful consideration. The potential impact of AI goes way beyond healthcare.
It affects everything.
It does, from the future of work to our very understanding of what it means to be human.
So it's not just about healthcare, it's about the future of humanity.
Exactly, and that's what makes this so fascinating and also a bit daunting.
Well, let's unpack some of those bigger questions.
Okay, sounds good to me. Yeah, it really is mind-boggling when you think about how much AI could change things.
It's not just healthcare either.
No, not at all. It's everywhere.
Like AI is already affecting how we live our lives.
From how we shop to how we get our news.
It seems like every day there's something new.
It's true. And as AI gets even smarter, it's going to raise even more questions.
About what it means to be human.
Exactly, like what makes us unique.
What can humans do that AI will never be able to replicate?
Those are questions people have been asking for a long time.
But AI makes them feel more urgent.
I agree, because now we're not just talking about tools.
We're talking about machines that can learn and adapt.
Even create.
Things we used to think only humans could do.
Right, and that leads to all sorts of ethical dilemmas.
Like, what happens if machines become more intelligent than us?
Or what if they start making decisions that have a huge impact on our lives?
It feels like we're entering a whole new era.
Doesn't it, like uncharted territory?
It's exciting, but also a little scary.
I know what you mean. The potential is incredible, but the consequences could be huge.
It's like we're standing at the edge of a cliff. We have this amazing view.
But we could fall.
Exactly. So how do we prepare for this future?
How do we make sure we're making the right choices?
I think education is key.
I agree. Everyone needs to understand the basics of AI, how it works, what it can do.
We can't just leave that knowledge to a select few.
Right, we need to demystify AI, make it something everyone can grasp.
And encourage critical thinking.
Yes, people need to be able to question the assumptions built into AI systems.
To think about potential biases and limitations.
We need to be informed citizens, not just passive consumers.
Because this technology is going to have a huge impact on our lives.
And we need to have open and honest conversations about the ethical side of AI.
Like, what are the values that should guide its development?
What are the limits, the lines we shouldn't cross?
These are tough questions, but they're crucial.
The choices we make now will shape the future of AI.
And the future of humanity.
That's a heavy thought, but it's also empowering.
Because it means we have a say in our own destiny.
We're not just bystanders, we're active participants.
So let's make sure we choose wisely.
Well said.
This has been The Deep Dive. Thanks for joining us on this exploration of AI. We'll be back soon with more deep dives into the frontiers of knowledge.
Until next time, keep asking those big questions.